caretakers of a patient came and reported in real time while we were at the rally that I have a patient right now in Mulago, Masaka, this referral. And they have refused to work on the patient. They want money for a scan, we don't have it. They also want 450,000, I think, for medicine or something. And then we agreed with the senior minister that I come in real time, because usually when you talk about it with the doctors or nurses, many of them deny. So when we came, the caretakers were able to identify the person, and they were able to arrest them and they charged them, and we left the patients. We made sure we go after Dr. Senyondo had come with another doctor. So we left the patients in charge of Dr. Senyondo. He said we are trying to kick out the vice. Me personally, I have ever defended a doctor. The RCC was once arrested a doctor. The other one was a nurse, a male nurse, but for him he arrested a real doctor for, I think, taking money from a Caesarean mother. And that time I vouched for the doctors. I said, please forgive the doctor, they will change, please. And we spoke to Dr. Kalima, Dr. Senyodo, to speak to the juniors. And they said we shall speak to them and they change. But it is sad that even me, the one who used to vouch for them, I'm now caught in a position where I have to use the iron hand. You know, you're aware government is now committed on just an end to corruption. No excuses, no nothing, no cover-ups. So I came to you to find out since then, what steps could you have taken? Exactly what can we do to churn out this vice? I was also told about the scan, that it is down. Have you been able to work on it now? I just wanted to know between then and now, because it's a week now since that happened. I just wanted to know how far have we gone in improving, because we have to improve together. All of us have to do what we have to do in order to make sure we improve.
All right, so Honorable Minister, you're welcome. As a regional referral hospital, we provide services to 2.6 million people in the region. We get clients referred to us from all over the region, from 9 districts and 1 city. And we offer quite an array of services. This is a regional referral hospital. It's a tertiary service. So we have very many specializations in different areas. We have specialization in radiology. We have a radiologist. We have pediatricians for the children. We have obstetricians for the adults, the pregnant mothers. We have physicians for the adults. And we also have some specializations like for the bone, for the eyes, and for the ears. And in the radiology subspecialization, we are glad that government has supported us in not so far back past. We received the CT scan, and this CT scan is a bit advanced from the X-rays, and we also offer ultrasound services. For the X-rays, the X-ray was donated to us by the Coffee Foundation, and it's up and running. The CT scan has been functioning until recently, when it broke down. It has a table which moves in and out, but this table has broken down, and it's usually serviced by Ministry of Health contractors. So they were called on ground, and they came around recently, and they assessed and said the machine has broken down. It needs a spare part which needs to be imported. So we are still waiting for them to import the machine, the spare part that needs to be replaced, and then we can have it up and running. So this CT scan is at a fee because of the high costs of running it. we have guidance from the permanent secretary from the Ministry of Health, and that's Dr. Atwine Diana, who issued out a circular to that effect, that we charge the CT scan between 120 and 200,000. This cost ranges because of the different specialization you can do with a CT scan. There are those who need a dye to be able to understand the conditions they have. Then there are those who don't need a dye, like for example, if somebody gets head injury, you can do a CT scan without injecting a dye to what we call a contrast. So that's the challenge we are facing, but the machine has really, really been helpful. It has been helping us a lot. Ministry of Health is aware that the machine has broken down, and its contractors have been to the ground, they've assessed, and they've gone back. However, Madam Honorable Minister, not once or twice do we even do it for free.
Because I was coming to the question that what if there is this person who completely has no money?
We even have records in the private wing. We are literally running on a low budget. We always, because you know this is a regional referral, we have very many highways which you are aware of. We have the one to Sembabule, Chotera, Mbarara, Masaka, Kampala. We have the one to Kalangala. We do get, even the road traffic accidents that occur within the city. So we get quite a number of unknowns who don't have people who can pay for them. And several times we've waived off and done the CT scan for free. And we do keep that record so that we can give you the magnitude of how many free scans we are doing. So we do quite a number of scans for free of charge when the patient is unable to afford. So we have standard procedures usually follow. If somebody is unable to do, if somebody is not able to afford, there are those who are named, but you really assess and see this is a very poor person who cannot afford. So the specialist usually waives off requests, we waive off, and there are 3 officers who accept and review, and we waive off for that patient. Yeah.
How long does this review take?
The review of waiving off, it's immediately.
When it's officers review?
No, we have different people who countersign for the specialist, and then we do it for free.
The other person was if the government CT scan is high end, and that's why people pay that fee for maintenance. When it's down, they send them to other hospitals, Chitovu, BNC, and other facilities. You mean they also have the same, or they have other scans?
It's the same machine. It's the same CT scan machine. Ours is the most subsidized. In private setting, the cost is usually higher, and we tend to work on so many
why
people.
I'm saying is like, I mean, why I'm concerned is if you keep sending them to the other people who do the service at about 250 and 300, theirs never go down. Ours, which is cheaper, is regularly down. So what could be the problem?
So sometimes it goes down because of the electricity surges, and other times it's because of the wear, the high volume, the high volume of patients we see in our facility also contributes to its breakdown. Yeah.
Because I'm thinking the higher volumes are in the privates, because people are always being sent there. I don't know if I just show up on bad days, but for all the times I've done impromptu visits, even when I was a senior presidential advisor, I just keep finding people being sent to private facilities.
No, it's unfortunate that whenever you come is when the machine is down, but when services are running and people are getting a service, they are not bound to complain. But when this machine runs down, like I've told you, we receive quite a number of accident cases that are utilizing it, and you find that most of the times.
Would you maybe recommend a second machine?
Yeah, I think it's in the pipeline. If you could allow, we would even have taken you for a tour of the hospital. We have a very nice radiology block which is being put up, and we hope once it's completed we shall also get an MRI which is even more superior to the CT scan.
When could this go? RCC aware of this construction, this ongoing construction, and when it could be
by
ready?
the UPDF It's being contracted by the UPDF.
Okay. We can count on the UPDF. They usually respect their timeline, unlike other contractors. But they told you to be done in how long?
I've forgotten. I think you need to cross-check the records. This is our principal hospital administrator who is usually in charge of most of the construction, infrastructure, and
Yeah, my name is Hannah Robert.
Well done, Robert.
Thank you. You are welcome. Thank you.
When are we having this facility complete? Because now I'm thinking we need to vehemently push for a second machine. Yes, Dr. Senyo.
Yes.
Well done.
Yeah.
I think we need to push for a second machine.
Yeah, that is as the acting director informed. At least there is hope that we are getting more advanced equipment. Phase 1 was major on constructing the block and external works, plumbing and electrical, which is left about 6 months for completion. Then we shall go into phase 2, where the ministry and UPDF
We need to visit this block house.
will agree on when to procure those equipment. But in
I
phase
think we
1,
need to push for them to come very fast. So phase 2 is the procurement of the equipment.
that will be phase 2. But phase 1 is about to be completed.
Is the maternity ward that we visited with the Minister of Economic Monitoring when I was still a senior presidential advisor, Honorable Akori, is it ready now?
Yes, functions.
Yeah.
And mothers are using it?
Yes, we've occupied it.
Okay. That's a good.
Yeah,
That's
it
good
is
feedback.
functional, although it is also wanting more equipment, because the project did also have medical care unit equipment, and they are all there. But again, Ministry also gave us 100 mattresses and some beds, which we put. But the complex is very big. It's about
Now that I have you and I have Dr. Senyondo and I have director here, what does a mother pay for when they come to give birth?
for general services, they are free, unless a particular medicine is out of stock. That is when they are advised.
Because they swear to me that they are not getting free services. Everywhere I'm
But
going.
the ideal, free services are free. Private services are paid for.
Which are the
and
private services here?
All services, because we have a private wing, that structure you see there is purely private. However, there are some services, again, you also offer in private wing free, depending on the availability, because like immunization, we can't charge it. If you're a private mother and you want
What
immunization-
services do mothers usually pay for if they're not in the private wing, if they have not chosen to go to the private wing?
The only things the patients can pay for are one, CT scan. CT scan. 2, if they have to buy medicine, which is not available here. Apart from that, if they have to buy medicine or utilities, which are not here. But the services, the clinical services, that is the examination, surgery, is free for all mothers. If the investigations are maybe advanced, they are also not available here, like blood tests and everything, those ones they have to go out. But the clinical services, the surgery are free. But like they explained to you, we usually get stockouts. One of the things we have done is to try to have emergency, be prepared for emergencies. But at times you may find sutures are not there, catheters are not there, and then you send the mother to buy. The mother is sent to buy, and then the mother may say the services are not free. Yeah, that is when we have stockouts.
Your stockout usually happens in how long?
Maybe before stock out, when the National Medical Store delivers medicines, at times the fulfillment is about 70%, or 78 or 80, meaning That 20% which is not delivered, we always, if that is very medicine, for example, in the category
What do you
of
mean
20,
the fulfillment? Meaning what you
Like
have
You
like
make
on-
an order.
I
all
know that
doctors,
when
one
I-
non-established
Every
drugs.
month, every 2 months, we have an order. So after every 2 months, NMS is supposed to
Supplies.
deliver. So it supplies, and when it supplies, it may not supply all the things that you ordered for that particular order. Either it is they don't have it, or for one reason or another, but they may not follow.
They usually fulfill up to what percentage?
Like he has told you.
7 to 8%.
Yeah.
Still lacking.
And that is the normal order per our budget. But as you know, our budget usually is far, the patients we get, the things we need are usually far much more than what we get. So we may have maybe the suppliers, then after 6 weeks, we start running out of certain items.
And what
RCC, the last time we witnessed the delivery of the drugs, you were also here. According to you, they looked like they can.
And Honorable, maybe to come in a bit.
I think the last consignment lacked drugs for diabetes
and
and
hypertension and
blood pressure. I think they were not supplied.
Those are common illnesses.
and even drugs for sickle cell.
Drugs for sickle cell,
were missing.
even antibiotics we are limited. We get essential drugs, but nowadays with the changing pattern of diseases, usually we need more advanced drugs, and these ones usually we get in very small quantities, like for drug resistance diseases. And these are the mothers who come in when they are obstructed, they start forming pus. So when you do your culture and sensitivity, you need a certain drug, and that drug may not be available. Then you send the mother to buy the drug. Then the drug is very expensive. It costs almost more than even what the surgery would cost. An ampule, a dose is at 20,000, 50,000. Even in NICU itself, then you're going to. So you will get those problems. Yeah.
In fact, to add on that, at times what may term as stock out, it may not be stock out of a particular item. But because we have specialized staff, specialists and consultants, their prescription is not based in what is in store. They are looking at what will make the patient well and better. So in most cases, when they prescribe some of those very, I don't know which term I can use, very specialized drugs are not given by NMS. And we have been lobbying to see how best they can try NMS to get into these regional referrals and change their essential list of medicines.
The good thing, most of the drugs that would cater for mothers are now being freed from our budget, the essential drugs. So that gives us a leeway to look more at specialized drugs, but still the budget is small.
So essential drugs for mothers are being given more priority.
Yeah, they are being given more priority. They are what are called now no-cost drugs. For example, pitocin, which used to very essential in contraction, tranexamic acid, and other drugs. Generally, they are trying to relieve the basic drugs for what? For mothers. But again, that does not mean the mothers may not need more advanced drugs, depending on how they come and on how they present. And those are the challenges we do what we face.
Director, I think another problem we have here is that the batches of internees who come here, the little time I've interacted with the monitoring here, they have come out to be the one actually who are more in the vice of picking money from people. That's why I wanted to interest the administration that when these people come, like you are expecting them now to come, we need to at least talk to them in a very organized and somehow serious.
We do talk to interns. The interns have their challenges. We do talk to the interns. Maybe the where we have not been emphasizing is the legal consequences of some of these things, especially when they are caught in the vice. But we do talk to interns. Currently, we receive about not less than 60 interns, both doctors and nurses and midwives and others. But our accommodation for interns takes about only 15 or 20. 10 officially, yes, but at times they squeeze and share rooms. So there is that problem of accommodation. And then you have them sleeping in the slums or far from the hospital. So they are constrained in being here on time and in being here on whatever. Yet we had the block we had initially started building.
What happened to it?
Funding from the government, capital grant, I think, was somehow cut.
Has the work stalled or?
The work stalled for some time. And
About
it has
6
taken
years.
more than 6 years.
Stalled.
More than 6 years. Just outside the hospital here, if you're on Seboa Road.
In fact, it stopped around the 35%.
Yeah. So we have accommodation for them, and then there are those issues, and because they are more the frontline.
That one
workers,
was strictly for staff accommodation or internal staff.
It is in fact, it is a senior staff quarters, but depending on need, we can
we were thought
sacrifice
it would
it
be
and
better
give it to
for
the
the
interns.
interns to take it, because the frontline essential health workers like the anesthetists, those are the people we give priority. The people who work in labor suit, the people who work in the lab.
It was how many stories?
It is
Three
stories.
stories.
6 years is a long time. It stopped at 35%, you said?
Yes.
Due to lack of capital development budget from Masaka Referral Hospital.
The one that had
The other
complained
lady-
that they had refused to work on her because
First
she
of
didn't
all,
have 200,000.
I investigated the patient. The patient was not admitted officially, which means the surgeons were not prepared to work on her. Secondly, that patient had
What
been,
is to admit someone official?
officially is when the doctor admits a patient.
When patients come to
Waliwo
the
omulwadde
hospital,
okwereeta ku kitanda. According to what I found out, the patient was not officially
How can a
admitted.
mulwadde kwereeta ku kitanda?
It is common.
Mulwadde leereeta atya ku kitanda?
You will find out.
How safe are the rest of the patients if anybody can just come neyeewa ekitanda?
That is what we are going to find out. She had been a previous patient here. The 200,000 she claimed was money she was asked for. Was actually money meant to buy a mesh. A mesh is a kind of netting that is allowed to be put where the hernia is, because the hernia is a defect. It is like a hole in the abdominal wall. So she was told you will need a mesh. The price of a mesh would probably be 200,000. The mesh is not currently being provided by what? By NMS. Those ones, people,
But
patients.
now,
have
doctor,
to-
the way you saw that woman didn't even have 20,000 shillings.
That is the thing we are telling you exactly.
So now, in that instance, what happens? A patient is too poor. You're saying NMS didn't give us this. she's in excruciating pain, but she has no money. So what happens?
Exactly, that's what we are telling you, Minister, that we need a budget for specialized equipment and utilities to help us. And that budget is small. You've heard of orthopedic patients. Initially, we used to refer, our referrals out of Masaka were very high. And one of the problems was orthopedics. And now we have got an orthopedic surgeon. But the implants cost money and are very expensive. And you would like to have some of these few implants for such patients.
So what happened to her?
She went away.
You still couldn't invest 200,000 in her?
She disappeared.
She disappeared. I think with what happened, the fracas, we tried to reassure her, but we are in contact with
No,
her
but the only
because
assurance you needed is to
that-
get her the mesh and work on her.
yes,
Doctor, you can't say she disappeared. I left you with her. You had properly created rapport.
yes,
You even told me this is the first patient I'm going to work
Yeah.
on. I said, can I be sure?
Doctor,
You said
I'm an
yes.
obstetrician gynecologist, and I consulted with the surgeons. And the head of department of surgery can tell you.
Hello?
The head of department of surgery
Yes, it's me who sent him.
can tell you. And the head of department of surgery knew her.
It's me who sent him. I'm in a meeting with doctors. It's me who sent him.
The head of
That woman was in pain.
department.
You can't tell me she was sent away.
Hernias are not painful, Honorable.
She was. You
It
could
is
tell.
a hole, I'm telling you.
So what
it
kept
is a
bothering
hole.
her? What kept bringing her from home? She comes
It
from
is
college,
discomfortable and it makes your abdomen look bigger than it. Once a hernia is obstructed, then it's an emergency. By all means, you have to work on it. If it is reducible, then you do it.
Will you contact her and I pay that money and she comes and gets
We
the
would be
surgery she
honored,
needs?
your honor.
Please, kindly, you said you have a contact. Could you contact her?
Yes, we are going to contact the surgery team. Yes, because she was our patient. She had been on an outpatient basis. So when
She kept
yes,
being on outpatient
so
because
she
didn't
kept
have money.
coming back.
But
yeah.
now you're right, this is what we have to report. And
Yeah.
I think that is a perfect case
Yes.
for someone who keeps coming and going back. She
Yeah.
comes and she goes back. But what the doctors need to help her, they don't have it. And even now she doesn't have money for it.
Yeah.
But she's a Ugandan counting on her government for a solution. Because her government
Exactly.
doesn't
That's
have
why
money.
we are telling you, Honorable, as a regional.
And if I had been
hospital-
told that day that her problem, because when you gave me the assurance for me, I thought the next time I come back,
Honorable,
I'll just be told
we
she
tried
was
to
worked
get
on.
in contact with the people you left with us. We lost contact with them. And they would have known. You left
So
us
could
a
you kindly
contact
call
of
the
a
lady?
gentleman
Cool.
and a lady.
Would you? I probably left them and probably sent them to also do other things. Because
Yeah.
PAs can get
So
to
if they
certain hour.
keep in contact, I have the lady's number,
No,
your
contact
PA.
her now. I pay the money now, and then you can schedule her for surgery.
Okay.
Yes.
Then those are the patients who are very badly off. If we have some either medicines in the private wing, at times we waive them off. Like the way we do for CT scan, because CT scan, according to Ministry of Health standards, is supposed to be paid for.
How much?
But 200, 250 depending.
But Roche told me 120,000.
That
There
is,
a-
yeah,
one-
it depends on the region, the region of the body you are you're scanning. It will also depend whether you're doing a non-contrast or contrast.
So
And
those
again,
ones-
for the contrast, yes, the contrast means there is some medicine they have to give to make the picture more clearer. Yeah, so that one, a contrast costs more.
Doctor, however much, well, I have to.
But we do
I have to
wait.
hear you that maybe she wasn't in physical pain, but she was probably in emotional pain. That's why you say I'm so
Obviously,
bothered by her.
as a woman,
Because
she's
the way
in
she
a shock.
narrated, you could really, even the patients knew her. They knew that she keeps going and then she comes back.
Yeah.
And I think it was because she doesn't have money. So I think she kept thinking, if I keep going back, they will do something.
We'll
They
track
will-
her and work on her.
No, I need
in
you to contact the
with you.
surgery people.
Yeah.
so that they look for her and we speak with her, and then she can come and get her surgery and just live a normal life.
There is another concern, I don't know whether you
Yes.
shared it about hospital land.
Yes, please share it. That one I'm very much interested. Anything public land in Masaka, I am willing to put up the biggest fight.
Yeah, we have encroachers on our land.
Those ones, hand them to me.
Yeah. We were lucky that we had a quite big
Fight the doctors who are getting money from people. I also fight for you land grabbers of your hospital.
we have about 49 acres, but about a quarter is encroached.
Quarter an acre.
Quarter of the 49.
Quarter of the 49?
Yeah.
RCS, are you aware of this?
I am aware, and even the ministry sent surveyors to come and open boundaries.
Who encroached it?
It is the community here for a very long time.
The problem has
Been
been
the other time we had the PS here. We agreed that the government surveyor comes and open boundaries, and then we look for a solution. We are waiting for the report to come. Plus a team of Ministry of Lands and Ministry of Health sit together with us.
No, because we need to move them now. We need to compensate them. If the worst comes to the worst, if it requires compensation, you compensate them and they go out. Because if they stay, it gets harder. The longer they stay, the harder it is to evict them, and the more expensive it is.
In fact, it is one challenge in this office. Yeah, but we are praying that with you and the support of RCC, we can work together.
Have you taken any action towards engaging them?
They
were engaged.
They were engaged earlier on, but you know people here are stubborn. You give them as long as they see no continuous action being taken, they relax and they again engage in the same action. But at the moment, what is holding us is that report. Once it comes,
the survey was done.
It was done.
By
You
Ministry
just
of
need a
Lands.
report.
Yes,
You try and call Honorable Judith.
it was done. Actually, it is the one now holding us.
Let me send her a message.